For most of us, eating is something that we just do naturally. But for people living with esophageal disease, even a simple meal can become painful, stressful, or even impossible. These conditions can quietly impact a person's health, nutrition, and overall quality of life for years before they're even diagnosed. At Northwestern Medicine's Central DuPage Hospital, a major investment is bringing specialized care to patients across the region and beyond. Here with more is Dr. Shri Kamidori and his patient Carol Smeha. Thank you so much for joining us today. Carol, I really want to start with you. What symptoms first made you realize something was wrong?
Well, I had a very interesting case. All of a sudden, I just started losing weight that none of the doctors could explain. So I went through months of testing to try to figure out what was happening. And as I continued to lose weight, I became more fatigued. I would lose concentration. And I just wasn't myself. I didn't feel comfortable or confident anymore. So I sort of slowly isolated myself, and I knew that I had to get a solution to the problem. The last thing on earth that I thought I would ever hear was esophageal cancer. I had been completely healthy my entire life. I always exercised 5 to 6 times a week, was on a Mediterranean diet, never been in the hospital for any problem. So to hear that diagnosis, it just permeates you, and you're stricken by this silence where you go, what am I going to do? I mean, it's when you hear the word cancer, you think fatal right away. And after meeting Dr. Kamidori, I realized that there is definitely a way to survive this, and it has been an incredible journey. I owe my life to him, and I owe advanced endoscopy a great deal because they have allowed me through this entire process to continue on with my life. This was all done on an outpatient basis, which is absolutely incredible. So as I went through the journey, he was always there with me. I was never alone in going through this.
And doctor, why are some of these diseases so difficult to detect?
You know, the story that Carol has is more common than people perceive. I think most often we associate disease with symptoms. And in the setting for esophageal cancer, we understand that reflux or contents of the stomach coming up into the esophagus is what causes this, and many of us experience reflux, which can be a normal part of life. But when it becomes persistent, and it's often atypical symptoms or not symptomatic, is where we get into trouble. And esophageal cancer is one of those, unfortunately, where a lot of patients either don't take the symptoms seriously or simply just don't have the typical heartburn type symptoms. So we need to look at other ways, and this is where advanced endoscopy can really help us diagnose and treat these patients early.
What symptoms related to swallowing or eating should viewers never ignore?
So on the simple side, chronic heartburn, chronic food coming up into the esophagus, which we call regurgitation, and you're taking over-the-counter type medicines like Tums and other things on a constant basis is definitely a point at which you should see somebody. But if it gets even further and you have any difficulty swallowing food in any way, that could be a real alarm sign. So for sure we want to talk to a physician at that point.
What is advanced endoscopy, and how has it really changed treatment for these conditions?
Yeah, so to make this all successful, even if we diagnose a patient early, we needed the right tools, and endoscopy, like we've typically done with colonoscopy and upper endoscopy, has advanced so far now that we have many tools and innovative devices that can allow for resection or removal of tissue, and also treatment of any precancerous and complex benign diseases of the GI tract. And so this is the field that's evolving in front of us, and what we're doing and what we were able to do for Carol that eliminates the need for surgery and complex other treatments that can be debilitating and compromise quality of life.
What does the new Center for Advanced Endoscopy really mean for patients?
Yeah, I think one of the limitations with these advanced procedures is they have been limited to our academic medical centers or the high-end university centers in the cities. And one of the changes that we wanted to make in the Northwestern medicine system is greater access to this type of care. So we built the Center for Advanced Endoscopy in the western suburbs of Illinois to expand that reach. And so we now offer all the procedures that we would in an academic environment in this new center, which again provides a comfort level that's very different out in the community for patients to get their care where they live.
And where can our viewers learn more?
The best way to find out more is to go to nm.org and search for the Center for Advanced Endoscopy.